When RPD does not involve an aesthetic zone or replace teeth on only one side of the midline, extensive aesthetic evaluation is usually not necessary. The lab can select tooth mold and set denture teeth based on the patient's existing dentition. You only need to select the shade of the denture teeth. Go to the precision writing step directly. If the RPD involves an aesthetic zone and replace multiple teeth on both sides of the midline, the patient should be actively involved in the aesthetic evaluation. Aesthetic evaluation is generally more critical for maxillary arches than mandibular arches. Ask the patient to relax and smile naturally. Evaluate at both frontal and profile view. If the patient has an existing RPD, ask the patient whether they are happy with its appearance. If the patient does not have an existing RPD, for small aesthetic areas, you may use adjacent teeth or opposing arches as reference to select denture teeth and tooth position. For larger aesthetic areas, the anterior teeth on the Easdent impression obtained by using intraoral scan and impression with Easdent tray workflow can help. If the opposing arch has anterior teeth, first evaluate the aesthetics of those existing teeth. You can use the opposing dentition as a reference for the lab when setting up teeth for the new RPD. Clearly communicate your preference to the lab regarding the midline, incisal edge position, occlusal plane in relation to the opposing arch. If both arches are missing teeth in large anterior areas, the aesthetic evaluation becomes similar to that for complete dentures. The more teeth that are missing, the closer the technique approach complete denture protocols. In these cases, you should evaluate the aesthetic of the maxillary teeth from the existing RPD or the Easdent impression. Check the midline, incisal edge position, and horizontal plane, and use the phonetic evaluation to verify the position of maxillary anterior teeth. Once the correct maxillary tooth position is established, the mandibular teeth can be set according to the maxillary teeth and the mandibular ridge harmony. You can also refer to the education videos on what is ideal maxillary teeth position and what is ideal mandibular teeth position for additional guidance. For mold selection, if the patient is satisfied with the mold on the existing denture or Easdent impression, instruct the lab to duplicate it. If not, provide a mold guide for the patient to select. Always select the shade together with the patient using a shade guide. Specify the exact shade guide used when prescribing to the lab, as the shade varies among different systems. Inform the patient that the denture teeth offer fewer shade options than natural teeth, and exact match, especially to a single central maxillary incisors, may not be possible. Many patients prefer choosing a slightly lighter shade, anticipating future tooth whitening. Denture bases are available in multiple shades. Most patients has no preference. Standard pink is typically selected by the lab and is generally well accepted. Always provide all required photographs or face scans along with clear written prescription to the lab to ensure accurate aesthetic replication.